Cast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everybody. This is Veronica Posada with Physician Partners. Thank you very much for attending today's webinar on Covered California. I want to remind everybody that you are muted and you are welcome to ask questions at any time. Please just type them into the chat area and we'll make sure that into the questions section of your screen. We will cover the answers after the presentation is completed, but please type in your questions at any time. I'd like to welcome Victor Bloomberg with the San Diego Medical Society Foundation. He's been with the foundation for 3 years. He is a IT project manager and a Covered California certified provider educator. He's also been an LCSW since 1981. I would like to also inform everyone that he will be available at tonight's PRC showcase that starts at 5:30 at Scripps Mercy Hospital. He'll be available there to answer any additional questions regarding Covered California and any other questions that you have. We will go ahead and get started with a poll question. And the question is, checking patient eligibility for Covered California. Select one or more of the following answers there. We'll give you about 20-25 seconds to answer, and we'll go ahead and cover the answers in this webinar. Okay, we'll close the poll there. And I'd like to introduce Victor Bloomberg.
Thank you, Veronica, and also thank you, Dustin, for your assistance setting up this webinar. I'd also like to introduce a little bit the San Diego County Medical Society Foundation. The medical societies are about supporting doctors in the business of being physicians, and the foundations provide services to the doctors and the community. So our San Diego County Medical Society Foundation flagship program is Project Access, and Project Access connects certain patients with volunteer surgical teams. Thank you for the opportunity to provide information about Covered California today from the perspective of what physician practices need to know. So we are going to focus on the documentation of verifying patient eligibility, what is network adequacy issues and how to manage them, and how to tell the difference between a Covered California and an off-exchange plan. And off-exchange simply means that it's not part of the Affordable Care Act system itself. So we sent a multiple choice question out, and one of them was just read, and this is a good way of just organizing our discussion today. So patient eligibility. In the old days, you could check patient eligibility a week or sometimes even a month before the appointment, because in the old days with Medi-Cal and only employment-based plans, things would not change that much. But with Covered California, you need to check it the day before the appointment, and we'll get more into that later. And when you make a phone call and an insurance company staff person says, oh yes, this patient's eligible, writing a note what the insurance staff said isn't adequate, because there's an actual law in the state of California that says that what the insurance company publishes on their website for providers regarding verification of eligibility, they're legally accountable for what they say. But what a person says on the telephone, there's no support in the law for that. So we want to make sure, like, number one takeaway from today's presentation is to learn how to use the provider's portal, not the consumer portal, but the provider portal, and print the report about the patient's eligibility the day before the visit. And we'll talk a little bit more about why the day before the visit as we proceed. Network adequacy. A Medi-Cal HMO or covered California plan does not now have to provide annual reports about their networks. However, the legislature did pass a bill to that effect, and it's awaiting governor's signature. So if it's signed, it could become law. However, because of complaints from both providers and consumers, the Department of Managed Healthcare is investigating network adequacy. So this is a good example of civic involvement by consumers and providers making a difference. And one of the best examples of a network adequacy issue is when the primary provider does not have the same hospital admitting privileges as a covered California specialist, and so that disrupts the continuity of care. It becomes network adequacy if prior authorization that allows exceptions to maintain continuity of care is not made. That's when it converts to network adequacy as a denial of prior authorization. An off-exchange plan is a plan that's either an old-fashioned employer-based plan, what are called grandfather plans, but they aren't part of the covered California system itself. And the only way to confirm this is through the Covered California website, coveredca.com, or the plan crosswalk, and we've given you a link later in the slideshow about that. One of the major confusions about Covered California plans are the tiers, what are called the metal tiers. One of the insurance companies uses metal tiers in their contracting language with doctors. It's caused great confusion. So if you have a physician who said, I signed a plan, the platinum tier contract, that has nothing to do with Covered California consumer tiers, bronze, silver, platinum, and gold. So if a doctor says I don't have to provide services to a bronze tier type patient, that's not true. There were a set of Covered California ID cards issued early on when the initial rollout that missed the logo, the Covered California logo on the ID card. So if a patient comes in with an ID card that doesn't have the logo and claims, I am with Covered California, go with the consumer. The consumer is right, and verify it because it could be true. In the future, as the old cards get winnowed out of the system just through aged out and replaced, in the future, all the cards will have the logo. If you see a card with a logo on it, it's good to go. If it doesn't, it's worth using the crosswalk that we're giving you the link to double check, or to call check the website with the patient ID number and the plan name to confirm. A mirrored product is one that has an identical panel as a Covered California product, but it's not a Covered California plan. It's caused great confusion, and it's good when patients and physician practices complain about the confusion, because it lowers customer satisfaction because they think they have one thing and they have another, and it creates expense for the business practice trying to sort out the confusion. Complaining, we will talk about how to file complaints and where, is a proper and good thing to do. Okay, so document the verification of patient eligibility. Do this the day before the appointment, and one of the big reasons is you need to know the anniversary of when they signed up with California, and it could really be any time during the year because there are special enrollment periods such like that. For the first 30 days, whether a patient pays their premium or not, the physician will get paid. But on day 31 through day 90 of a patient being in arrears on their premium payment, the physician practices holds all the financial liability. They won't get paid. So you need to have your EHR or billing module configured with when is the effective date of the insurance. And you can see then on day 30, you hold no liability, but on day 31 you do. So by confirming things the day before, you're always protecting your practice's fiscal bottom line in terms of getting paid for the visit. Using the telephone to verify eligibility is risky because there's no protection for the physician practice unless you come up with one of those exceptional insurance company staff who will email or fax what they tell you over the phone, and then you have documentation. Otherwise, learn to use the physician login portal to establish the verification that the patient has paid up on their premium and is good to go. And so make sure all staff doing this know how to print the reports from the website or use the save the screen image on the computer. And that way, if you get an EOB that denies and you've got documentation that the insurance company said you're good to go, you will get paid. For medical society members, you have support services in appealing wrongfully denied EOBs, and you can still do it all on your own, and once you learn to do it, hopefully you'll have to do it less and less as these denials decrease. So here are the health plan contact numbers you need to have documented verifications of patient eligibility, and the slideshow which Physician Partners will have on its network, you can just click these and it gives you how to email and how to log in and phone numbers to call. Basically, I recommend to learn how to use their provider websites rather than using them to verify things. Network adequacy. Again, because there have been so many complaints, this is now under formal investigation, and legislation has been passed to try to tighten it up. But again, the main thing is accessibility and continuity of care for the patient. And the typical ones are about specialists, and if something goes wrong and they're admitted to the hospital and the hospital doesn't have a contract with Covered California, you're denied authorization to use that, then it becomes a network adequacy issue. When you find a network adequacy issue, and we'll get to what to do with that, document it, paint a verbal picture, and when you send a complaint, send it to multiple places so that the more channels that are flowing with this data, the more likely things will be improved. So this is where to send things. And again, these are interactive links on the electronic version that Physician Partners has. Department of Managed Healthcare, email it to the Consumer Protection at coveredcalifornia.gov, and they really care about this. And then the Office of Patient Advocacy is also another place to email that. And then you can send a copy to either me, and you've got my email there, but the Medical Society for Advocacy. You can, and if you're not a member of the Medical Society, I want to encourage you to join, because these assistance with contracts and in managing the complexity, I think this is a great time to have that support. And then when you have good relationships with your patients and you're all on the same page that you want to work together for quality patient care and continuity, go ahead and give out this to the patients and their family members, how they can send the same concern as consumers. And then you're getting the same story from both perspectives, the provider and the patient. So again, a contract tier is not the same as the insurance metal tiers of bronze, silver, gold, and platinum. What the consumer tiers are about is this. It's like a teeter-totter, a seesaw in a park. When the premium goes down, your out-of-pocket expenses go up. When your premium goes up, your out-of-pocket goes down, and silver fine-tunes that. That creates apples-to-apples comparisons so consumers can pick the plan that's best for them. It has nothing to do with the contract language between the provider and the insurance company. The only way to confirm is this a covered California plan is by the plan name. And each plan name has a unique alpha ID for the suffix for the EOB. So one of the links we give you is a complete listing of all these plans and their alpha ID and the plan name. So what you can do is create a searchable document for your billing staff, and all they have to do is type in the alpha ID or the plan name, and depending on where it comes up, what section of your searchable document, you can find at a glance, is this covered California or not. So use this plan crosswalk to find out. And then good communication and verification with physicians and providers when the physician and the provider directory conflicts. There are still physicians who do not know that they are participating in covered California or have confusion about the contracting language. And then there are genuine network adequacy. So forming that good communication with your counterparts in other physician practices can help you sort out the confusion. But then when you have this type of expenditure of staff time sorting things out, document that and then share that with your advocacy system, because this is a cost to the business, the time being taken away from patient care and directed towards figuring things out. So these links down here are where you find the covered California plan names, how to contact each of the carriers for the covered California plans, and detailed descriptions of all the plans. So just click these links, and it's like going back to school. You're learning by doing. These links, they're held accountable to, so they're good links. And this is a comprehensive page of links. Pretty much everything you might need to know about covered California from the Covered California website itself. Remember, if it says coveredca.com, it's Covered California. If it says anything else, it's somebody else. So go to coveredca.com to get the real information. And then some of these general resources are very helpful, including the Kaiser Family Foundation FAQs. And a recapitulation of the concerns about network adequacy, and then all of the statewide, all of the contact information for the plans, because sometimes people are traveling from other parts of the state and you'll need to contact them. So this one slide gives you all the links you possibly could need. Okay, that's the slideshow. There we go.
Okay, great. Thanks, Victor. Looks like we have a question, and the question is, okay, do the off-exchange mirrored plans have unique alpha ID or just covered California plans?
All plans have a unique ID on the EOB, and the crosswalk is what's going to give you the ability to sort that out by either plan name or EOB.
Okay. Do we have any other questions for Victor? While we're waiting for a few few more questions to come in. Victor, I'd like to share with you and with the attendees that the answers to the first poll question looks like we had 55% that answered A, 36 B, and a good majority of them answering C, which I believe was the correct answer. Checking patient eligibility, use a provider's portal, and print the report the day before is the way to go.
Yes, that's the way to do it. And the reason for that is if you need to appeal a wrongful denial, that it came from the patient portal and you've got printed documentation, you'll win the appeal. And that's by law, that's by statute.
Okay, that sounds great. We have another question here. Will the slideshow be available on the Physician Partners website? Yes, they will be. Everyone that's participating today will receive the slideshow tomorrow in an email. And this presentation has also been recorded and will be available in about a week on the Physician Resource Center website. Here's another question. Are the terms covered California and exchange synonymous?
No. Well, yes and no. Covered California is the California version of the Affordable Care Act. And what this is known as in states run by the federal government, because the states chose not to get involved, is they're called exchange plans, health exchange plans. So exchange is not used in Covered California because it's confusing, but off exchange is. You will find on some EOBs the term exchange. I would clarify with the insurance company, confirm that this is a Covered California plan through the plan crosswalk, because I've found that not everybody is exactly perfectly correct in their use of terms, and unless it has the Covered California logo on the ID card, I would go by the plan name and the EOB suffix, the alpha, and confirm it that way, and not count on the correct usage of the term exchange.
Okay, it looks like we have a few more questions here. If we check eligibility on day 45 of the anniversary and it shows pending because patient hasn't paid their premiums, can we ask the patient for cash, or how do we handle this?
Wonderful question. I am so glad you asked it. Yes, you can ask for cash. What you want to do to protect yourself from both social distress amongst patients as well as any other types of liability is to have the same policy for all patients, regardless of whether they're covered California or not, and have that clearly stated and available to everybody as standard procedure. And the policy, I'm going to give you an example, but every organization, every practice will come up with their own. But it says something like this. If for any reason your insurance is not fully in force, we will charge our customary fee for the visit. A schedule of the fee is available. And some practices have a cash discount, some don't. And if you do, you go ahead and state that. And so as long as you're charging the customary fee and all patients are presented with the same policy and procedure, then you're good to go. And it's very advisable to do that because in the old days, assignments of benefits worked. There's a new normal now, which is assignments of benefit doesn't work. So if it's a covered California plan and for any reason you're off you're an off exchange specialist or anything like that, they're going to send the money, the reimbursable money, to the patient and not to you. So the same policy of collecting fees, whether they're delinquent in their premiums, or there's an issue with either you or a referring physician being off exchange, either way, if you collect the money cash on the barrel at time of service, you will get that revenue, and otherwise you're not. So it's a good procedure for both reasons.
Okay. How do we know if the insurance is covered California when it's run under the HealthNet portal and the patient does not mention it on the phone call?
It sounds too simple to be true, but it's going to be the plan crosswalk. And I don't know if these links are going to work if I click them, but I'm going to try. But one of these links have a plan crosswalk with all the plan names in the EOB. So when they call, part of your workflow is, can you find do you have your insurance card handy? Mm-hmm. Can you please read to me the plan name on the card? And then if they say they don't have it handy, you say, well, this is a business protocol decision to make. Are you going to let patients make appointments when they don't have their ID card handy? Because if they don't have it handy, they can't give you the number over the phone. They can't give you the plan name, so you're assuming some risks. So I'm going to this is an experiment. Let's see if this will click into the site. And while we're doing this experiment, let's go to the next question.
Okay. For the previous question, can you please repeat the policy examples?
Sure. I'd be happy to. All the plan names, and it's a beautiful little document, and that's what it looks like. And these are the covered California ones. And so by default, if you're and it's 12 pages. I won't go through it, of course. But if you search a plan name and it doesn't show up here, it's off exchange by default. And this will be updated with every plan year. So this is the 2014 version. And so that was the first one I clicked.
Victor, can you, that sheet you just pulled up, can you take it down to the HealthNet name? Please, look, we have a question that is, for example,
this one?
Yes. Can you go to the H portion of it for HealthNet?
Okay. There we go.
Okay.
Let's see how many pages HealthNet is. It's one page. That's convenient.
Okay. And so the question is, for example, HealthNet covered California plan names are, or the program name, HN Community Care HMO or Direct Network HMO?
Okay, now I'm not an expert on all of these plan names. I'm sort of the guy who teaches you how to fish, but I don't know every fish in the lake, if you get my meaning. So can you restate the question, and I'll either have an answer or I'll say, I don't know. Let's try it again.
Okay, so whomever sent this question in, if there's another way to ask it, please resend it. But what I have here, it says here, sorry, not a question, but an example. See plan name.
It is an example.
Okay.
Yeah. So, but this is great. I'm glad we're doing this because this shows how useful this is like one of the best things you can get out of this webinar is this handout, and you've got it's just a click away because it's got all the plan names and the plan name ID on the card. Mm-hmm.
Okay, well, it looks like we've gone through all the questions. Any more questions? We have just a little bit more time if you want to send over some additional questions. Otherwise, a reminder that Victor Bloomberg will be available tonight at the PRC Showcase at Scripps Mercy Hospital West Auditorium from 5:30 to about 7:30. So it looks like no other questions have come through. So we'll go ahead and conclude today's webinar. Thank you very much, Victor. Thank you, everyone, for participating. And
my pleasure, and thank you for the invitation.
oh, what here? I'm sorry, Victor. Here's a question. Could you just put the page 12 document into an email link to send around on its own, so we don't have to go searching for it? Okay.
This is Dustin. I'll just jump in and provide a different answer here. So what we can do with the information that Victor's provided, we can pull just that one document out and put it as a separate link in the email that you'll get tomorrow from GoToWebinar. And you'll see one link to download the entire presentation and a secondary link to reference just this 12-page document that covers all the plans.
And the other thing I would like to say to y'all is that this email address that is now on the screen, victor.bloomberg@sdcms.org, if something comes up and you've got an example or clarification, feel free to send me your question, and if we know the answer, well, I'll just provide it. If it's something I'm not sure about, I'll research it, so we'll learn together. But we're in your corner. And then again, if you're a medical society member, we'll actually help go to bat with you.
Great. Thank you very much, Victor.
Yes, thanks, Victor. Thanks, everyone. Have a good rest of the day. And thank you, Veronica.
Thanks.
Okay.
Everyone.
See you later, Victor.
Good day. Bye.
Bye.